Nurse Ralph Jason Ching has been working in the same hospital for 18 years now, but he hopes to leave the Philippines soon in search of a healthier work-life balance. He's applied for an overseas posting with an agency that specializes in recruiting nurses for the U.S. It didn't take him long to find an employer.
Ang bilis po ng hiring nila, no? I was fortunate enough na nagkaroon po ng isang employer. They finance everything po, from the review to the mga registrations and everything. Kasama na po yung processing ng visa.
Ralph Ryan Garcia is a newly minted nurse, having passed the Philippine licensure exam last year. But he's not planning to make a career out of it at home. He knows nursing is a tough profession, but believes he needs to go where he can be better compensated for his work.
The quality of life that I could have abroad is going to be better than staying here in the Philippines.
Times have changed, and when I interview students, what is your primary motivation? Why do you want to take up nursing? They usually say they want to help their family. And helping their family means they have to leave the country. So I cannot do anything about it because that's the reality. That's the sad reality.
The Philippines and its healthcare conundrum. Nurses are taught and trained that the job is a calling. But to an ever-increasing number of new and veteran nurses, it's a ticket out.
Our nurses are globally accepted, and it seems that most countries that are developing health systems try to hire Filipino nurses, which is like, I now consider it not a problem, but our soft power.
In the developed world, coming under the care of a Filipino nurse is almost universal. For the Philippines, it's a source of national profit over healthcare pain. Some 300 to 350,000 Filipino nurses are spread out across the world, while their country is lacking around 160,000, according to the Department of Health. The pain points at home: low wages, long working hours, a heavy workload, and job stability that's not always guaranteed. Filipino nurses are a labor product made for export. However, while the Philippines also churns out sailors, industrial and domestic workers by the tens of thousands, their migration does not carry the same public health consequences.
Every patient has the right to make their own decisions about their body and treatment.
The exodus leaves many local hospitals understaffed, impacting patient care, especially in rural areas. Those who stay face intense burnout.
In some hospitals, one nurse would be dealing with 25 patients, 50 patients, but in fact, it's recommended dapat one nurse to 3 patients lang.
Talagang displaced po ang mga nurses natin. Hindi malinaw yung mga programa natin para sa kapakanan at future ng ating mga nurses.
Liza Policarpio is only too familiar with the challenges. The daily struggle has become a source of dark humor among colleagues, but in the end, nobody is laughing.
Sabi nga namin, pag nagbibituan kami, 1 nurse is to 1 ward. Sa 100 patients, minsan 2 lang po yung nurses. So, syempre, nagkakaroon din po ng burnout sa mga nurses natin.
Nursing is a very stressful profession. You go to bedside, you are dealing with death, you are dealing with sadness, you are dealing with grief, you are dealing with irate patients and irate family. It's like going to a battlefield every day.
Yet for Ms. Policarpio, the incentive to stay is not hard to find.
Hindi ko kayang iwan yung family. Parang ang hirap sa loob na iiwan mo yung family, mga bata, at yung father mo na old age na rin and bedridden.
For others such as Abby Nemesa, who came back from lucrative nursing posts in the UK, and 21-year-old Brisbane Bognot, the profession is a national service.
Alam naman po natin na sa Philippines, understaffed po tayo. And nakikita ko po na parang mas makakatulong po tayo kung dito po tayo magsastay sa Philippines.
I know bottom line of everything is to lift your families from poverty, lift yourselves from all those financial difficulties, or you wanted to explore the world, but please work for the country first and be part of the solution that we really wanted for a very long time.
In 2024, Filipinos abroad sent home a record $38.3 billion in personal remittances. There's no official breakdown for overseas healthcare workers, but groups such as Filipino Nurses United estimate that nurses alone contribute around $8 billion a year to the economy.
If you opt to work outside Philippines, does it make you less of a Filipino? Of course not. It makes you more of a Filipino. You're giving more to the Philippines because you're giving remittances to your family, and that helps our economy.
The government does not intend to curb nursing exports to address the domestic shortage, but it continues to work on incentives to encourage these healthcare workers to stay home.
We're trying to be competitive with our salaries. We've started to increase the government salaries for nurses, which is much higher than that of the private sector. So we're increasing the other benefit packages for nurses, like housing, car loans, and other benefit packages, health insurance, so that they will be discouraged to leave the country and stay with their families here.
The government is offering more, but for many nurses, not soon enough. Reforms are underway, but they take time, while overseas offers can come in days with clearer promises of pay and benefits. For Ralph Jason Ching, it's not about wanting to leave, it's about not having enough reasons to stay.
It's not just about the salary. No? Yung work-life balance na may time ka to spend with your family, your time to spend para sa sarili natin. Kung may ganun sana na situation, no? I would rather choose to be here, of course, sa Pilipinas.
Leaving home may be a painful choice, but for many Filipino nurses, it's the only viable one.
Providing care is a calling, not a profession. It's what Caroline Thomas says she learned from her mother, who is also a nurse. But for the final year nursing student graduating this year, home isn't where the heart is.
My dream is to work in USA.
It's not due to a lack of jobs in Kerala where she lives, but rather the pay, which falls short of what she says she needs for a comfortable life.
For my profession, that kind of pay is only providing in the abroad countries. So I think it's better to have some experience here. I think 2 or 3 years, then I should move to abroad.
Nurses in private hospitals in India can earn from $200 to $600 a month. But in Gulf countries, they can make up to 3 to 5 times more and up to 10 times more in North America and Europe. Government jobs in India pay significantly more than private ones, but nurses complain vacancies are few and far between.
If we get into the rank list, we have to wait for years to get a placement.
For others, such as Abel Prince, yearning for a job abroad is not merely about finances. It's also about finding dignity in an environment where nurses are just as valued as doctors.
In India, especially in Kerala, it is considered as a job lower to doctors. Conversation or the attitude of patients or the clients with the nurses is not well appreciated, whereas in out of India, it is more appreciated.
It's a perfect storm of low pay and grueling working conditions, putting India in an awkward position. It trains more nurses than any other country in the world, nearly 400,000 annually. But a significant portion of them move abroad. About 640,000 Indian nurses are estimated to be currently employed in foreign countries, ranking second only to the Philippines in nurse migration. The building blocks of India's healthcare system and a vital link in the global healthcare workforce are shaped in colleges like these where nurses are trained. This is one of 150 such institutions in this state. NIMS College of Nursing is training the next generation of caregivers. The COVID-19 pandemic ramped up demand for healthcare workers, with the World Health Organization projecting a global shortage of about 4 million nurses by 2030. India is positioned to fill that gap with its vast pool of healthcare talent.
By various consultancies coming forward to our institute and offering the training programs to our students. So finally, once they complete their course, so they can have ample of opportunities in abroad also.
Some 500,000 nurses from Kerala already work abroad. The state also leads other Indian regions in the number of nurses emigrating, a trend that goes back decades. The migration of nurses from Kerala took off after World War II, when Christian missionary networks helped recruit healthcare professionals from here to countries like Germany and the UK. In the decades that followed, the Middle East became a major destination. Now, as European countries are facing a severe shortage of healthcare staff, programs to train nurses here and send them to those countries are once again gaining momentum.
Verb plus, subject plus, object.
Fluency in German is now a coveted skill. Hundreds take lessons each day at Non-Resident Keralites Affairs or NORCA's Language Training Institute. In December 2021, the state's main agency responsible for migration affairs signed a deal with the German government to supply nurses for the European country's struggling healthcare system. The program is called Triple Win, encapsulating the Kerala government's philosophy behind training and supporting the nurse migration. Officials say the hiring country wins by procuring talent, nurses win by earning more, and the home state wins through remittances from abroad. But critics accuse Kerala state officials of institutionalizing brain drain at a time when India's nurse-to-patient ratio stands at 2.23 per thousand population, below the WHO's benchmark of 3 per thousand. Officials argue the issue is more complex and that there's actually an oversupply of nurses in South Indian states.
There are no dearth of nurses because 25,000 every year we are getting 20 to 25,000 nurses are coming out of this institution. So currently in my state they are facing underemployment because nurses are working at inferior, at very low salaries.
But across the country, the picture is starkly different. Reports say 9 out of 10 people living in rural India must travel more than 10 kilometers to access health care. The Indian government says it's invested billions of dollars to add 82% more medical colleges between 2014 and 2023 and added 157 new nursing colleges in the same period. But experts say the country should spend close to 5 to 10% of its GDP on healthcare, up from about 2% presently if it's to cater to the health needs of 1.4 billion people. They also argue it should provide more funds to improve healthcare staff pay that could potentially reverse the migration of healthcare workers.
Think about the issue for the next maybe the 50 years. So we need more money there. That's the bottom line. We need more money there. That precise training for particular subject is we have a deficit there. For example, if you take ICU, intensive care unit, maybe a cardiothoracic unit, or maybe a coronary care unit.
Officials say one idea that might work is promoting reverse migration through exchange programs, which can potentially address such skill gaps.
The nurse can come back to state and support our Indian health system because they are exposed to the global conditions.
Those who choose to stay despite more lucrative options abroad provide another boost to the country's healthcare system. Some say care is simply about giving back to the community.
Why should I give my hard work and my talent and my skills to a foreign nationals, that I am born and brought up here, that I should serve my country.
Whether at home or abroad, Indian nurses continue to answer their calling, serving on the front lines of a profession on which millions depend for survival and care.
"25 years ago, Louis Horn left the Philippines to become a nurse in the UK. Back then, she found she was just one of 5 foreign nurses at her hospital in East England. Fast forward to the 2020s, and for every UK-trained nurse joining the National Register, an internationally trained nurse joined too. But last year, that changed. The government tightened entry for overseas nurses to try to lower record-high net migration numbers, shifting resources and recruitment in favour of domestic staff instead. Visas became 7% more expensive, and foreign nurses in the private sector may now have to wait 10 years for settled status, rather than 5, to live in the UK indefinitely. This, combined with poor pay compared to their counterparts in the US, New Zealand and Australia, has made working in the UK less attractive to foreign nursing talent. As a result, the number of new joiners here has dropped by half.
It's very important as a trade union for us to protect these workers, to make sure that they are safe where they're working, they're not treated unfairly, and that we don't increase the vulnerability they're feeling by giving them these new visa rules that restricts them from staying here.
There's also a worsening issue with racism and xenophobia, according to workforce surveys, making foreign nurses feel even less welcome.
I think it's still an attractive destination for international nurses and healthcare workers, but it wasn't the #1 choice like it was before.
Around a fifth of the National Health Service workforce was born overseas. Half of those are Asian, mostly Indian and Filipino. It underscores that international perceptions of life here are vital to recruiting the healthcare workers required to sustain the system.
What we're quite concerned about is that it will give the message that the UK isn't a secure place in that way, where you can come and you know this is what the situation is going to be. I never hear people complaining that they have to have a visa. I think that's not the issue. I think the issue is that kind of certainty about what they are paying the money to be here for.
As London attempts to reduce reliance on international workers and the number eligible for permanent residency, the UK's care sector for elderly people has seen an even greater shake-up. Care homes are effectively banned from hiring abroad. They can no longer sponsor the visas of any applicant who is not already living here legally in the UK. The government told CNA that's also because there were unacceptable levels of abuse and exploitation of arrivals, in some cases leading to debt and mistreatment. That's something the industry recognises, but says it warned the government about this when care visas were provided to foreign workers en masse during the COVID pandemic to help fill more than 100,000 vacancies.
We've always had, in both health and in social care, a percentage of a migrant workforce, and when the visas were issued post-COVID for social care, we did have an influx of people. We did at that time say, could you just make sure that they were for people who were registered providers, and they didn't take notice of that. And of course there was an influx with families, and that has been the challenge. I think that's the biggest challenge.
The NCA says a largely domestic workforce will always be the better option, but it's been impossible to achieve.
The simple answer could be, OK, well, you increase wages. But of course, social care is predominantly reliant on public funding, and providers have argued that often they're operating below the fees that actually cover the costs of care and are dependent on private sources of income through people paying for their own care.
With salaries limited, international recruitment essentially forbidden, and a growing elderly population, the care sector is worried for what's to come.
The government decisions on migrant workforce for social care has already had an impact. I mean, firstly, we cannot accept applications from overseas, which is devastating. And what they've said is that we can only recruit migrant workers that are already in the United Kingdom.
That's particularly frustrating as Mr. Segal found success recruiting from southern India, where there's a plethora of nursing graduates, a larger pool of qualified people willing to work than he can find in Britain. And the government may still change the rules for those already here, forcing them to wait 10 or even 15 years for permanent residency or to bring family over, which is harming retention.
The rest of the world, fortunately for them, is actually welcoming Australia, Canada, Ireland, the EU. They have the same needs as we do, but they are more welcoming. And they have less stringent rules and less sort of draconian rules around family life and everything else.
That's left some of his staff feeling uncertain about their future. Alamin Mia came to England in 2021 to study business administration. He graduated from university in Bangladesh but struggled to find fulfilling work there. He's now a carer in rural East England.
Lots of people are suffering in different type of dementia, different type of disease. But what I found, it's enjoyable to work with them, to help them.
But he's frustrated by the way care is funded, which in turn affects what he and his colleagues can expect to be paid.
It's very difficult to survive here when you are working in care sector. But if you see what we are doing, we are giving our best. We are working very hard to support people.
The government is creating a new body that will negotiate pay between trade unions and employers, which it claims will be raising care workers' salaries by 2028. Too little, too late, says the care sector, which believes that won't be enough to encourage enough domestic workers to fill the gap created by the sharp fall in overseas recruits.